medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
One of the things as clinicians we basically face every day is folks that have high blood pressure. And we're always looking for something natural. So I want to go over some of the things that I use that may be helpful for you. One is French maritime extract. It's an antioxidant. It's used for heart and artery health. You may not be overly familiar with it, but it does help with high blood pressure and will improve the blood flow into the legs and even helps with diabetes. One of the best amino acids that I've ever seen is L-citrulline. I try to use the amount that's equivalent to eating an entire watermelon. Yeah, that much, because its conversion to L-arginine actually works better than using L-arginine for several reasons, not to be talked about at this minute, but it does help erectile dysfunction and does bring high blood pressure down. The one that you probably all recall and use is magnesium, because magnesium is hundreds of chemical reactions per second, and it will for sure help the nerve transmission, the immune system, and of course to decrease your blood pressure. If you're not using a nitric oxide supplement, please get a hold of me. I'll tell you the best one. I basically lectured for pretty much all of them. And there's no question when you use nitric oxide supplement, you are improving the endothelial lining, which caused probably the blood pressure issue most of the time. Beetroot falls right into the same category. Beets are naturally rich in nitrates, and they too can convert to nitrates as long as the stomach and the bacteria in the tongue cooperate. You might not be aware, though, of apigenin. Apigenin is a flavonoid. It's an antioxidant, but it also helps for blood pressure reduction and in many other things. And vegetables like parsley, celery, onions, fruit like oranges, and herbs like chamomile and thyme, oregano and basil pretty much have this, as well as plant-based vegetables like tea, beer, and wine. Pick your choice. Berberine, which we hear so much about for not only weight loss, but we also hear about it for sugar, also helps with high blood pressure, which is a little known factor. So using a pretty good amount of it could be extremely helpful. And along with all this, of course, is coenzyme Q10, often removed by certain drugs, as you're familiar with, but it does help along with everything else in high blood pressure. And last that I want to bring, but not least, is the herb garlic. I use that pretty much to treat high blood pressure. In one study I've read, it literally has the equivalent efficacy of a beta blocker. They've done certain studies with it. I urge my patients to take it only at bedtime because of the sulfide bridging, and that can actually not let you think as clear as you should. So if you have to take a test or operate machinery, it's best to take it at night because you could get some cloudy thinking of it. But anywhere from 2,000 to 2,500 milligrams is often what I use. A product that's good, and make sure it has good odor, because the allicin also is helpful, not just for as an antiseptic, but also for the blood pressure itself. Now, I don't use just one. I do overlap several of them because the idea is to try to bring down somebody's blood pressure, but do it as naturally as possible. I hope this helps you. And even if you're using blood pressure medication, try several of these products in addition. So at the end of the day, it's all about our patients, isn't it? I'm Mitch Ghen. If you need any information, please just contact me at drmitchghen.com. That's drmitchghen.com. Thank you so much for watching, as always, and we'll see you soon.